There are things your doctor tells you when they hand you a prescription. Take it with food. Avoid grapefruit. Come back in 3 months. But here is something they almost never say. And if you've been waking at 3 in the morning since you started your blood pressure pill, lying there with your legs cramping and your mind racing, wondering why you feel more anxious than you did before you started taking a medication that was supposed to make you healthier, this video is specifically for you. Because the answer is not in your head. It's not aging. And it's almost certainly not on your prescription label. And today I'm going to tell you what certain blood pressure medications are quietly removing from your body. Why your standard blood test will never catch it, and the one thing I now say to every single patient the moment I write them a new prescription. Stay with me, because by the end of this video, you'll understand what's happening inside you, and you'll have a specific, practical way to answer it. Let me explain what's happening, simply. A large class of blood pressure medications are called diuretics, water pills. They work by making your kidneys flush more fluid from your body. Less fluid volume in your blood vessels means less pressure on their walls. It works. The science is solid. But here's what happens that nobody tells you about. When your kidneys flush fluid, they don't sort carefully. They take magnesium with them, and potassium, and zinc, every single day. Now, magnesium is not just a supplement you see on a pharmacy shelf. It is involved in over 300 enzymatic processes in your body. Your heart rhythm, your sleep architecture, your muscle function, your stress response, your blood pressure itself. A 2018 study from the Rotterdam study, one of the largest and longest-running cardiovascular research programs in the world, following nearly 10,000 people, found that thiazide diuretic users had nearly 3 times the risk of developing low magnesium levels compared to non-users. Nearly 3 times. A separate study published in Archives of Internal Medicine measured magnesium in 320 elderly patients on diuretic therapy. Those on thiazide diuretics showed significantly reduced levels, compared to patients not taking the drug. Now, I need to tell you the part most doctors miss entirely. When I first learned this, I went back and looked at years of my own patient charts differently. Because here is the problem with the standard blood test. Only about 1% of your body's total magnesium is ever in your bloodstream. The other 99% is locked inside your cells and stored in your bones. So when a blood test comes back and says your magnesium is normal, your cells can still be critically short, and the test will never show it. This is why so many people feel worse after starting a blood pressure medication and their doctor looks at the numbers and says, everything is fine. Everything is fine on paper. But inside the cells, something is missing. I want to tell you about a patient I'll call Arthur. 68 years old. Retired engineer. Sharp mind, methodical thinker. The kind of man who read the package insert before taking any new medication and kept a spreadsheet, a literal spreadsheet, of his blood pressure readings going back 4 years. He'd been on hydrochlorothiazide, a thiazide diuretic, for about 2 years when he came to see me. He wasn't there about his blood pressure. That was controlled. He was there because he couldn't sleep. Not couldn't fall asleep, couldn't stay asleep. He'd wake at 2 or 3 in the morning, heart fluttering, legs cramping, mind already running. He was exhausted by midday and anxious in ways he had never been before. His GP had checked his thyroid. Normal. Checked his heart with an egg. Normal. Referred him to a sleep specialist. Normal. Arthur looked at me across the desk and said, I've had 5 appointments in 8 months. Every single doctor says I'm fine. But I feel terrible. I asked him one question no one else had thought to ask. Has anyone checked your magnesium? Not your serum magnesium, your red blood cell magnesium. He looked at me like I'd switched languages. No, he said. Not once. We ran it. His red blood cell magnesium was meaningfully below where it needed to be. Not catastrophic, but real. We didn't change his medication. We didn't add a new drug. We changed what he ate. Within 3 weeks, the night cramps stopped. Within 6 weeks, he He was sleeping through. He sent me a message one morning that just said, "I woke up at 7. First time in 2 years. Arthur wasn't broken. His medication was doing exactly what it was supposed to do. It just needed a footnote." Now let me give you that footnote. Here are 5 warning signs your magnesium may be running low. Count how many apply to you. Be honest with yourself. Warning sign number 1. Leg cramps at night. Magnesium is the signal your muscles need to relax after contracting. When it drops, muscles stay tense. They spasm. That cramping in your calf at 2 in the morning, that is often not a circulation problem. That is a magnesium problem. Warning sign number 2. Sleep you fall into but cannot sustain. Magnesium regulates GABA, the calming neurotransmitter. Your brain uses to quiet itself for sleep. It also helps your body produce melatonin. When magnesium drops, the brain can't fully switch off. You're exhausted, but you keep waking, wired and restless at Thram. Warning sign number 3. Heart palpitations with no obvious cause. A flutter, a thud, a missed beat. Magnesium regulates the electrical signals that control your heart's rhythm. The Framingham Heart Study, one of the most cited longitudinal studies in medicine, found that low serum magnesium was linked to a significantly higher risk of atrial fibrillation. If your heart has been doing things it didn't used to do, please bring that to your doctor. And mention magnesium. Warning sign number 4. Anxiety that arrived with the prescription. Not your personality, not your life circumstances. A background hum of unease that wasn't there before. Magnesium modulates the HPA axis, your body's central stress response system. When magnesium drops, cortisol rises. The world starts to feel slightly more threatening for no reason you can name. Warning sign number 5. Constipation that arrived quietly and won't leave. This one almost nobody talks about. Magnesium is what drives peristalsis, the wave-like contractions your gut uses to move food through your system. When magnesium drops, those contractions slow. The American College of Gastroenterology and the American Gastroenterological Association. Now both recommend magnesium oxide as a first-line evidence-based treatment for chronic constipation. If you've become more constipated since starting your diuretic, that is not coincidence. If 3 or more of those sounded familiar, please do not dismiss them as aging. They are a message. Your body is specific. It is asking for something specific, and I want to give you that answer now. Now, can you just take a magnesium supplement and fix this? Possibly, and in many cases it makes sense. But I want to give you the food solution first, because food delivers magnesium alongside the cofactors that help your body actually use it. No capsule fully replicates that. Here are 3 foods. Simple, affordable, effective. Food number 1. Pumpkin seeds. 1 small handful, about 1 ounce, contains roughly 156 milligrams of magnesium. That's nearly 40% of your daily recommended intake. From a handful you can sprinkle on oatmeal. Toss on a salad. Keep in a jar on the counter. No cooking, no preparation, almost no cost. Arthur started here. He told me later that he kept a small bag in his desk drawer at home and ate a handful every afternoon like clockwork. Food number 2. Dark chocolate. 70% cacao or higher. 1 ounce contains approximately 60 to 65 milligrams of magnesium. It also contains flavonols, compounds that support blood vessel flexibility and have been independently associated with lower blood pressure in multiple trials. 1 square after dinner. Not a bar. 1 square. That's the prescription. Food number 3. Black beans. Half a cup of cooked black beans delivers around 60 milligrams of magnesium. They're also rich in potassium, the other mineral your diuretic may be flushing out. And their fiber slows glucose absorption, reducing the blood sugar spikes that put additional strain on your cardiovascular system from a completely different angle. Add them to soups. Stir them into rice. Eat them warm on their own with a little olive oil. They absorb whatever flavor surrounds them. And they cost less per serving than almost anything else on this list. Now, about supplements. If your kidneys are healthy and your doctor agrees, magnesium glycinate or magnesium citrate are the best absorbed forms. Magnesium oxide, the cheapest and most common form, has significantly lower absorption and is more likely to cause digestive discomfort. Typical doses range from 200 to 400 milligrams daily. And I want to be very clear. If you have kidney disease or if you take other medications that may interact with magnesium, do not supplement without discussing it with your doctor first. Magnesium clearance depends on kidney function. If that function is impaired, supplementation needs to be supervised. Before I give you this week's action, I want to say something directly. Blood pressure medication saves lives. Diuretics are a first-line treatment for hypertension for good reason. If your doctor prescribed one, that was likely the right decision. This video is not a reason to stop your medication. It is a reason to have a conversation your doctor hasn't started yet. A conversation that goes like this. I've been reading about diuretics and magnesium depletion. Can we test my red blood cell magnesium, not just serum? And should I be thinking about what I eat to support this? That is a reasonable, well-informed, specific question. Any doctor worth their time will take it seriously. This is the footnote your prescription didn't come with. The one thing I now say to every patient the moment I write a new prescription, this medication is doing one important job. Our job, yours and mine together, is to make sure it isn't quietly creating another problem while it does it. Let's talk about what you eat. That conversation has changed a lot of lives. I hope this video starts that conversation for you. This week, a handful of pumpkin seeds daily, black beans twice, 1 square of dark chocolate after dinner, and ask about your red blood cell magnesium. Arthur got his sleep back. Your body is not failing you. It's asking for something specific. And now you know exactly what that is. Before you go, something that follows directly from what we just covered. Blood pressure medication is not the only common prescription that depletes magnesium. Acid reflux medications, the proton pump inhibitors, that millions of people over 60 take every single morning, also block magnesium absorption. Not by flushing it out through the kidneys, by blocking the specific intestinal pathway your gut uses to absorb it in the first place. And when someone takes both a PPI and a diuretic, which is extremely common, because acid reflux and high blood pressure often travel together, a population-based study from the American Journal of Kidney Diseases found the depletion compounds significantly. In my next video, I'm covering the acid reflux medication story in full, including a nutrient beyond magnesium that PPIs also deplete, a nutrient your bones, your nervous system, and your memory all depend on, and whose deficiency in some patients looks almost identical to the early stages of cognitive decline. If you take omeprazole, lansoprazole, or any similar medication every day, that is not a video you want to miss. Subscribe. Hit the bell. I'll see you there.